Welcome, curious minds, to another deep dive. Today we're taking a truly insightful plunge into something that might seem, well, a bit niche at first glance. We've got sources focusing on an exam review for certified nursing assistants, CNAs.
Right.
But don't let that title fool you. Our mission today, it's definitely not just reciting facts.
No, not at all.
Instead, we're going to pull out those really vital, sometimes surprising bits of knowledge, the things that truly define the daily life and critical responsibilities of these healthcare professionals. We're looking for those aha moments, about patient safety, critical thinking, and the human connection that's so central to their work.
And it's quite remarkable, actually, how these scenarios, which seem straightforward in an exam context, reveal such incredible layers of complexity. Real responsibility.
Yeah.
You'll see how a CNA's immediate actions, their keen observations, and really understanding the why behind their tasks. It can dramatically impact patient well-being. Sometimes it literally saves lives.
Okay, let's unpack this. Let's really get into what it means to be informed about the world of CNAs. It's clearly more than meets the eye. Let's jump right in with the high-stakes stuff. What does a CNA actually do when every single second counts? In an immediate crisis.
Well, this gets right to the core, doesn't it? Decisive action. When there's a crisis, that first action is almost always about immediate safety and getting help.
Okay, like what?
So take a patient who suddenly slumps over in their chair. The immediate practical step. Assist them back upright. Get them safe.
Makes sense.
Or say a patient mentions even mild chest discomfort, maybe after a spicy meal. Sounds minor, maybe. But the crucial first step for the CNA is notifying the nurse right away.
Why so urgent?
Because chest pain, any chest pain could always signal something serious. You just don't wait.
That proactive, immediate response. It's vital. Okay, what about something really dramatic, like a seizure, patient twitching, eyes staring?
Right. In that case, it's not just standing by. The CNA has to call for help immediately, protect the patient from hitting anything, getting injured, and...
This is important time, the seizure.
Okay. And falls. That must be terrifying. If someone falls while walking, maybe without their gait belt.
The very first action is call for help. Then, quickly check. Does the patient have a pulse? Are they breathing? It's about that rapid assessment, that triage.
Got it.
Or think about choking. Patient suddenly grabs their throat, coughing motion but no sound. That's the universal sign.
Yeah.
The CNA needs to perform the Heimlich maneuver. Immediately. That's a direct life-saving intervention right there.
Oh, okay. Another emergency.
Even something seemingly small, like a fire in a trash can, the absolute priority. Get all the patients out of that room first. People over property, always.
And it's not always about the patient, right?
Right.
What if, say, a visitor is found on the floor, not moving, nobody else around?
Same principle. First action.
Oh.
Check for pulse and breathing. If there's none, start CPR. Okay. And what about an immobile patient who starts vomiting while lying flat on their back?
Oh, that's dangerous. They have to be turned onto their side immediately, right away.
To prevent aspiration, right? Vomit going into the lungs.
Exactly. And one more common one. Patient spills hot coffee, skin gets red, maybe blisters. Rinse the area with cool water, then notify the nurse. Simple actions, but they prevent worse harm.
These immediate responses really show the CNA as that frontline responder, don't they?
Absolutely. But beyond those crisis moments, CNAs are constantly working to prevent common dangers. Think about falls. They're a huge concern.
So how do they manage that risk day to day?
Well, basic things, but crucial. Answering call-outs promptly, checking frequently on patients who are weak or unsteady, and even coaching dizzy patients. Ask them to stand for a few seconds before they start walking, let their blood pressure adjust. These small, consistent things make a massive difference.
It's interesting. Our sources mention things like bed alarms as restraint alternatives.
Yeah, that's a key point. A bed alarm signals if a patient tries to get up, alerting staff without physically tying them down. It promotes safety and freedom.
And speaking of restraints, the sources are very clear.
Absolutely. All restraints, physical or even chemical, they always require a doctor's order. No exceptions.
Okay. And what about skin? Keeping skin healthy seems vital.
Incredibly vital. For comfort, preventing infection.
Yeah.
So, simple things like putting a pillow between an immobile patient's legs. It pads those bony spots, helps prevent pressure sores.
And what about patients with really fragile skin? Maybe they're on blood thinners.
Gentle touch is essential, non-negotiable. And any new skin tears or red streaks or bruising, even if it seems like it came from something routine, like removing a gait belt that has to be reported to the nurse
Right.
right away.
Yes, and understanding how to use tools safely is just fundamental, like electric razors.
Yeah,
Can't use them if oxygen is present. Big fire risk.
right.
Gait belts are essential for helping weak or unsteady residents move safely. They provide that crucial support during transfers.
And think about patients with diabetes, maybe neuropathy, reduced feeling in their feet.
Mm-hmm.
Making sure they wear proper shoes when they're out of bed is a critical safety step. Protects against injuries they might not even feel. It's all about anticipating risk,
Hmm.
trying to head things off.
This leads perfectly into what I think might be a CNA's greatest superpower. Those keen observational skills.
Mm-hmm.
Knowing exactly what needs to be passed on to the nurse. They really are the eyes and ears, aren't they?
Absolutely. If you look at the bigger picture, the CNA is often the very first person to detect subtle but really significant changes in a patient's condition.
Like what sort of subtle changes?
Well, imagine a patient who usually eats poorly, but suddenly they're hungry and thirsty all the time. That's a big change. Needs immediate nurse notification. Could signal a new problem.
Okay. What about mental changes?
Sudden confusion is a major red flag, like a patient asking for a relative who passed away years ago.
Yeah, that's concerning.
And what's really insightful here is that confusion, it can often be a sign of something like a urinary tract infection, a UTI. The CNA might be the first to spot those behavioral clues. Reporting it quickly could prevent a much more serious issue down the line.
And obviously, abnormal vital signs are critical to report.
Definitely. Our sources highlight specific numbers that are outside the normal range, like a temperature of 99.9, a pulse way up at 114, respirations at 24, or maybe a low blood pressure like 98/62.
So it's the deviation that matters.
Exactly. Those numbers signal a potential problem. It's different from normal vitals, pulse 60 to 100, BP 100, 119/60, 79, temp around 97.6 to 99.6, respirations 12 to 20. Those usually don't need immediate reporting. It's recognizing the change.
Not just a static number.
Right. Exactly. Even changes in, say, urine. Cloudy urine with a strong smell from a drainage bag. Nurse needs to know, and a sample needs to be saved. Or a diabetic patient feeling dizzy and weak before lunch. That's urgent. Could be low blood sugar. These details are vital clues for the nursing staff.
Speaking of vital clues, recognizing stroke signs must be high on the list.
Absolutely critical. Things like difficulty holding something, maybe a paintbrush, slurring words, or if one side of the face droops eye, lip, cheek, every second counts with a stroke.
Yeah.
Also, respiratory distress, coughing, wheezing, difficulty breathing. Even if the CNA thinks they might have caused it, maybe with an aerosol spray, report it immediately. Patient safety comes first, always. Take responsibility.
It seems like observation extends even to the environment.
It does. Overflowing trash cans, soiled items on the floor. The CNA's job isn't just to tidy up, but also to report it. It could indicate other issues, maybe neglect or a patient struggling.
And what about observing coworkers? That must be tough.
It can be, but it's an ethical duty. If a CNA sees a coworker slip a patient's ring into their pocket during care, or finds suspicious marks like red streaks or bruises on a patient that another CNA might have caused, that must be reported immediately. It protects the patient.
So, with all these crucial observations, do the sources point to one thing as the absolute most important function, the core of that observational superpower?
They do, actually. It's stated quite clearly and powerfully. Reporting anything abnormal to the nurse is the most important function of a CNA.
Wow.
It really emphasizes that their constant vigilance, their communication, that's paramount, often more critical than any single task they perform. They are that first line of defense.
That's a really profound insight. It shifts the focus, doesn't it? It's not just about physical care. It's about understanding, connecting with people, especially when they're vulnerable or confused.
Exactly. And a key insight from the sources is this emphasis on therapeutic communication, recognizing that every single interaction is a chance to offer comfort and dignity.
How does that play out?
Well, say a patient says something like, "I'm afraid of dying." A therapeutic response isn't dismissing it. It's reflecting it back like, "I believe you said you were afraid of dying," and then inviting more. Can you tell me a little more about why you feel this way?
So, validating their feelings, opening a door?
Precisely. Active, empathetic listening. And simple things matter too. For patients with hearing loss, just speaking slowly, maybe using a lower pitch, can make a world of difference.
Yeah. And nonverbal cues?
Oh, huge. Looking at your watch frequently while a patient is talking, that sends a clear message of impatience or disinterest, even if you don't mean it to.
Right. What about communication during tasks, like oral care for someone unconscious?
Safety first. Only use a tiny bit of water to avoid aspiration. Shows how even small details impact safety. Or if a nonverbal patient starts, say, screaming or hitting during care,
What do you do?
you stop. Make sure they're covered, maintain dignity, then calmly explain what you need to do using simple, reassuring terms. It's about de-escalation and respect, always. And when dealing with dementia, those challenging behaviors, the general approach is always a slow, calm voice. Rapid speech can really increase anxiety.
That makes sense.
For tasks like eating or getting dressed, providing simple step-by-step instructions helps. Or just laying out clothes in the right order. It breaks down complex sequences.
What about things like hallucinations?
The advice is usually to gently redirect the patient to a real activity, or sometimes just ignore the hallucination. Arguing about what's real or not real isn't helpful.
Okay. And sundowning,
Yeah.
that late day agitation.
Yeah, that can have different triggers. Maybe hunger, fatigue, or just a change in their routine can set it off. Understanding potential causes helps manage it.
And wandering must be a major safety concern.
Huge. Patients who wander need constant supervision. The risk of elopement leaving the facility unsupervised is significant. Safety is paramount. You also see something called perseverating.
What's that?
It's when a person repeats a word or phrase over and over again. It's often a neurological symptom in dementia. CNAs learn techniques to gently redirect or reassure someone doing this.
Okay. And incontinence, particularly with dementia.
Routine is often the best approach. Taking the patient to the toilet regularly before and after meals, before bed. Establishing that predictable schedule can really help.
And if a patient becomes agitated?
Engaging them in a positive activity can work wonders. Going for a walk, singing a familiar song, maybe working on a simple puzzle together, it helps redirect that energy constructively.
So, pulling this all together, promoting dignity and respect seems to come down to some fundamental but powerful actions.
Absolutely. Things like always knocking before entering a patient's room. Seems small, but it respects their space.
Yeah.
Allowing patients to choose their own clothes whenever possible. Letting them discuss their beliefs, especially religious beliefs, without judgment.
And acknowledging grief.
Recognizing that everyone handles grief differently. That's a crucial reminder for CNAs. They need to tailor their approach. Even in postmortem care, dignity remains the focus. Gently cleaning the body, dressing it in a clean gown. And for patients who are unresponsive, maybe near the end of life, regular turning isn't just for preventing bed sores. It's also about providing comfort. It's about respecting the person right to the very end and even after.
This deep dive really shows that CNAs aren't just, task doers following orders. They need a real foundational understanding of the human body, common conditions, the whole care system.
It's far more complex than a checklist, definitely. If we connect it back to that bigger picture, the CNA's actions are almost always guided by that broader care plan, right? And an understanding of the patient's actual health status, which brings up that important question, what's actually in their scope of practice and what's out?
Okay, let's talk conditions first. Cognitive changes.
The sources make a clear distinction. Mild forgetfulness can happen with normal aging, but dementia, that's a serious progressive loss of mental abilities. Alzheimer's specifically involves tangled nerve fibers, protein deposits in the brain. No known cause or cure yet. And importantly, the sources state that trauma or falls are not generally accepted causes of dementia. That's a key piece of knowledge.
That is a critical distinction. Okay, other conditions, like Parkinson's.
With Parkinson's, which affects movement, the CNA would assist with grooming as needed, maybe using an electric razor if tremors make a blade unsafe, assuming that's what the patient normally uses.
We already touched on diabetes, that pre-lunch dizziness concern. What about COPD?
Chronic obstructive pulmonary disease. The sources highlight that patients often feel like they just can't breathe. So CNA needs to be really attuned to their respiratory status, and understanding basic body systems helps them recognize when things go wrong. The nervous system coordinates everything. The integumentary system skin is our shield. Circulatory system delivers nutrients, oxygen, removes waste, controls temperature. Respiratory system handles breathing trachea, lungs, etc.
And age-related changes.
Yeah, like older residents often losing subcutaneous fat. That affects how they perceive temperature, makes them feel cold more easily. Little things that impact care choices.
So let's talk care plans and scope. Who makes the plan?
The care plan itself, that blueprint for care, it's developed by the registered nurse, the RN.
And the CNA's role?
Is to follow it precisely, even if it seems odd sometimes. Like the example, dressing a resident in a long-sleeve shirt, even if it's hot outside, if the care plan says so. There's usually a reason, maybe skin protection or regulating body temperature.
Okay. What can CNAs absolutely not do? What's outside their scope?
Clear boundaries for safety. They generally cannot remove an indwelling Foley catheter unless they've had specific training and it's delegated by the nurse. It's
Yeah.
usually a nursing task.
Okay.
They definitely cannot consult with a doctor on treatment plans. That's way outside their scope. And they cannot insert catheters.
But what can they do in relation to, say, feeding tubes?
They can position the patient correctly for a tube feeding, getting them aligned properly so the nurse or another professional can safely administer the feeding.
Right. And PPE. Gloves. Hand washing.
Personal protective equipment. Gloves are definitely required for things like perineal care or shaving a patient.
Yeah.
Prevent spreading infection.
But the golden rule.
Hand washing.
Yeah.
Always.
Mm.
Before and after. Every single patient contact, every single task, even if you wore gloves, it's the absolute cornerstone of infection control. Non-negotiable.
Nutrition seems like another big area of knowledge for CNAs.
It is. And the sources point out the most essential nutrient, water. Simple but fundamental.
And different diet types.
Oh, there are many. NPO, nothing by mouth, often before surgery. Low protein diets for kidney disease. Low sodium diets, no salt for heart issues, kidney problems, fluid retention. Fluid restricted diets for conditions like heart failure to prevent fluid buildup.
Okay.
Then you have low fat diets, maybe for heart attack risk or gallbladder problems. And puree diets, food blended into a thick paste for people with chewing or swallowing difficulties.
What about thickened liquids? Is jelly one?
That's an interesting point in the sources. No, jelly, despite its texture, isn't medically considered a thickened liquid for those who need specific liquid consistencies to prevent choking.
And speaking of choking, preventing aspiration during meals.
Key safety measure. It means offering small, manageable bites of food. Being patient, observing carefully.
Okay, last big area. Professional conduct and ethics. How should a CNA handle resigning?
Professional. Submit a written letter. Give 2 weeks notice. It ensures a smooth handover of care, which is really important.
And dealing with criticism.
Need to know the difference between constructive and hostile. You need to be more accurate in your charting. That's constructive. It points to an area for improvement.
Versus
You never document right. That's just hostile, unhelpful, and unprofessional.
HIPAA comes up again here, obviously.
Absolutely. The law protecting health information privacy. It's fundamental. A patient's name, address, diagnosis, treatment. It's all protected. Only shared with those who truly need to know for providing care.
And legal issues, like neglect.
Neglect could be something like failing to lock a wheelchair before transferring a patient. It's a failure to provide necessary care to ensure safety.
Battery.
That's touching a resident without their permission. Even if the intent wasn't malicious, consent matters.
And false imprisonment. That sounds serious.
It is. And it could be, for example, using a gait belt tied to a wheelchair to keep a confused patient seated just because there isn't enough staff to watch them properly. That's restricting freedom without a proper medical order. It's illegal and unethical.
Who advocates for residents in these situations?
The ombudsman. They're a crucial legal advocate, an independent voice fighting for residents' rights, especially in long-term care.
And continuing education.
CNAs need 12 hours per year to keep their certification active. It ensures they stay current with best practices.
Finally, stress management. What's not helpful?
Complaining about responsibilities, apparently. The sources suggest focusing on positive coping mechanisms, problem-solving, self-care, not just dwelling on the negatives.
Wow. Okay, we have covered an incredible amount of ground today, from those split-second emergency actions and the really subtle observations that can save lives, to the ethical complexities, the communication skills, the sheer human connection involved. It's just abundantly clear that the CNA role is incredibly vast and vital and really multifaceted.
This deep dive, it really does highlight that knowledge in this field isn't just, memorizing facts for a test. It's about understanding how systems connect, anticipating needs, acting with precision, yes, but also with real empathy.
Yeah.
You can really see how every single detail, things that might seem small, they genuinely matter to a patient's well-being, their comfort, their dignity.
And that's what makes this work. And honestly, learning about it's so utterly fascinating. It's this constant demanding dance between skill, compassion, and critical thinking, all happening in real time.
Yeah, and one of the most powerful takeaways for me is how that continuous learning, that diligent application of all this knowledge, it ultimately contributes so much to patient comfort and dignity. Even when circumstances are really challenging or patients are incredibly vulnerable, it's a testament to their dedication, really.
So what does this all mean for you, our listener? Well, next time you hear about healthcare, or maybe you interact with a healthcare professional yourself, just consider the incredible breadth of knowledge, that keen observation, that profound human responsibility that goes into their daily care. From the smallest detail right up to the most life-saving intervention, it's truly a world of often unsung heroes, isn't it?